It's my honor to be here today to speak on this very important occasion, our nation's Veterans Day. Today's true VIPs are our veterans. It's an honor for us to publicly recognize you for your selfless service to our nation. My name is Dr. Byron Hepburn. It's been my privilege to serve as the director of the Military Health Institute at UT Health San Antonio. I also have the honor of being a clinical professor in the Department of Family and Community Medicine. Our university has the noble mission of making lives better with a specific focus on the citizens of South Texas and San Antonio. To further support that mission, the Military Health Institute was established in 2014 to improve the health and resiliency of our nation's veterans and their families. As you all know, November 11th is Veterans Day, a day of national remembrance and solemn reflection. For those of you who may not remember the history of Veterans Day, it began on the 11th hour of the 11th day of the 11th month of 1918, when an armistice was declared between the Allied nations and Germany in the First World War, known then as the Great War. The following year, November 11th was commemorated as Armistice Day. It became a legal federal holiday in the United States in 1938. In the aftermath of World War II and the Korean War, Congress in 1954 changed the name from Armistice Day to Veterans Day to become a holiday dedicated to the American veterans of all wars. Since our nation's founding, millions have served in our armed forces, the Army, Air Force, Marines, Navy, and Coast Guard. Here in the state of Texas, there are over 2 million veterans. In the greater San Antonio area, over 250,000 veterans call Military City, USA, home. Of importance, those veterans and their families have lived and continue to live lives of selfless service, excellence, and integrity, and they bring those values to our city every day. I want to give Dr. Henrich a sincere thanks for his dedication to our region's veterans and their families. UT Health San Antonio has a strong commitment to helping our South Texas veterans move beyond any barriers that they may have. More than 430 military veterans are part of our own faculty and staff. These veterans bring a unique perspective to their work, having served in developing nations and in combat environments. And you can double that number when you include spouses and their family members. Some defended the nation in some of the world's most hostile regions. They continue to lead a life of selfless service following their transition from the military. At UT Health San Antonio, we have many examples of that selfless service and dedication. I know firsthand that many of our veterans have worked tirelessly during the course of the COVID-19 pandemic and continue to do so. We salute them. Today, I would ask that each one of you at 11 o'clock pause and reflect on the freedoms that we enjoy, that we have sworn to protect, but also recognize the great men and women that serve before us. God bless America.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Hello, everyone. On this special day, we honor all members of the armed forces who currently serve and who have served our country. Our veterans are examples of the core values we hold dear at UT Health San Antonio. They are selfless, brave, and loyal heroes. They have long given their time and risked their lives willingly to protect our democracy. Over the years, millions of these distinguished citizens have said goodbye to their families to fight world wars, Cold Wars, and the wars in the Middle East. So this year, the global battle was different and the enemy unforeseen. When the coronavirus invaded the world in early 2020, our own veterans at UT Health San Antonio answered that call of duty. Navy Reservist Scott Farber, Lieutenant Colonel Stephanie Rowan were among them. In March, Dr. Farber, an assistant professor in the Division of Plastic and Reconstructive Surgery, deployed to New York City, where he worked as an ICU doctor at one of the hardest hit hospitals in the country, directly treating patients with COVID-19. Lieutenant Colonel Stephanie Rowan fought the battle at home, right here in Military City. One day, she was caring for head and neck cancer patients as a senior clinical research nurse in both the Department of Otolaryngology and the Department of Comprehensive Dentistry. The very next day, she provided support to her troops in the 149th Medical Group of the Texas National Guard. The Texas National Guard provided free drive-through COVID-19 testing sites in rural areas across Texas. As the chief executive nurse, Rowan monitored the health and safety of her troops on the front lines of COVID-19. And she's here with us today. Our appreciation for their dedication to our community is endless. I personally want to thank all of our veterans, active service men and women, as well as their families, to know we are forever grateful. They answered our nation's call to duty. Today and every day, we honor you.
Thank you, Dr. Henrich, and thank you for your continued leadership and support. I would now like to introduce Lieutenant Colonel Retired Stephanie Rowan. Stephanie is a translational science PhD student here at UT Health San Antonio and recently retired from the Texas Air National Guard after 24 years of service.
President Henrich, Dr. Hepburn, fellow military members, veterans, and honored guests, it is my privilege to be here to speak with you today. Americans enjoy great freedoms because of the sacrifices men and women from the Revolutionary period to this very hour have made to defend our nation. Veterans Day offers us a time to pause, remembering those brave individuals who faithfully served our nation both here at home and abroad. We celebrate today the men and women who have honorably served on active, reserve, or National Guard duty with our 5 military branches, including the Army, Air Force, Navy, Marines, and Coast Guard. Veterans Day is very special to me this year as I celebrate my retirement after 24 years of service in the United States Air Force and Texas Air National Guard. I am proud to be joining the more than 16 million living U.S. veterans having served in or during at least one war, with over 2 million of those being women. It has been a true honor to serve this great country, to work with some of the finest, most dedicated people I have ever met. Looking back, I am most proud of the countless times where healthcare professionals at all levels would pull together as a team in the face of significant adversity to save the lives of service members, their family members, and local Texans during Hurricane Harvey and the COVID pandemic. As Major General Jimmy Keenan used to say, we take care of America's sons and daughters. So on this Veterans Day, I remember the words of President John F. Kennedy that we must find time to stop and thank the people who make a difference in our lives. And as many veterans, I come from a proud military family. I wouldn't be here today without the sacrifice, love, and support from my grandfather, Ensign Leo Rowan, United States Navy, World War II pilot. My husband's grandfather and grandmother, Lieutenant Colonel Hallam Reed, United States Army, World War II Commander of Rome. And Betty Sauerländer, United States Navy Wave and World War II nurse, both of whom recruited me to the Air Force Nurse Corps. And finally, my youngest brother, United States Navy Petty Officer, 3rd Class, Hospital Corpsman Emmett Blake Rowan, who died 2 years ago while serving on active duty as a respiratory therapist at Balboa Hospital, San Diego. I have nothing but the deepest gratitude and appreciation for them as they set the bar high, inspiring me with their service and leading the way forward. And now it's 2020. We are in the midst of a global pandemic. National tensions are at an all-time high. And yet, as a new veteran, I draw on the strength of perseverance learned over my military career and instilled by excellent mentors. Here at UT Health San Antonio, I have been blessed to know and work with many dedicated veterans across the medical school, dental school, and nursing school. Veteran leaders such as Dr. Frank Miller, Dr. Michael Huber, Dr. Lark Ford, and Dr. Stacy Young-Magana, all who exemplify success as defined by General Colin Powell, success being the result of perfection, hard work, learning from failure, loyalty to those for whom you work, and persistence. These veterans lead teams caring for cancer and trauma patients, discovering new ways to manage PTSD, testing for COVID, and training the next generation of nurses, dentists, and physicians. As a UT Translational Science PhD student, I am thankful to have their example as my guide as I learn to be a veteran leader. Clearly, there is no mystery behind the endurance of American freedom and liberty. It is through the courage, loyalty, perseverance, and sacrifice of those that have stepped forward to serve in our armed forces. Veterans Day 2020 is an opportunity for us as a nation, state, and military city USA to come together in thanks and celebration. I encourage everyone to make time on Veterans Day and throughout this November to personally reach out to a veteran or veteran's family to let them know how valued, respected, and appreciated they are. Now more than ever, openly share your gratitude, respect, and kindness because you never know how much someone, a veteran, may need it. Thank you, and God bless.
Thank you, Lieutenant Colonel Rowan, for your excellent and heartfelt comments. They were outstanding. A sincere thanks to all who contributed to today's event, and thanks to all who joined us to honor our nation's veterans and their families for their selfless service to our nation. God bless America.
Oh, beautiful for spacious skies, for amber waves of grain, for purple mountain majesties